Influenza, commonly known as the flu, is a contagious respiratory illness that affects millions of people every year, especially during seasonal outbreaks. According to health experts like Dr. Monica Altman, understanding how influenza spreads and how to protect oneself is the most powerful tool in reducing illness, complications, and unnecessary fear. Influenza is caused by viruses that attack the nose, throat, and sometimes the lungs, and it can range from mild discomfort to severe illness and even death, particularly in vulnerable populations such as children, the elderly, pregnant women, and people with weakened immune systems. Dr. Altman emphasizes that prevention is always better than treatment, and simple daily habits can significantly lower the risk of catching or spreading the flu. One of the most important points highlighted in Dr. Monica Altman's guidance is awareness of surroundings and exposure. Influenza spreads mainly through respiratory droplets when an infected person coughs, sneezes, talks, or even breathes closely around others. In crowded indoor spaces such as waiting rooms, public transport, offices, or schools, the risk of exposure increases. Dr. Altman has advised people to be mindful of where they sit or stand in such environments. For example, choosing a window seat in a waiting area or public place can reduce the number of people passing close by, thereby lowering exposure to airborne droplets. This may seem like a small detail, but repeated small precautions together create strong protection. Vaccination remains the cornerstone of influenza prevention, and Dr. Altman strongly supports getting a flu shot every year. The influenza virus changes frequently, which is why annual vaccination is necessary. The flu vaccine trains the immune system to recognize and fight the virus more effectively, reducing the chances of severe illness, hospitalization, and complications. Even when the vaccine does not completely prevent infection, it often makes symptoms milder and recovery faster. Dr. Altman stresses that vaccination is not just a personal choice but a community responsibility, as it helps protect those who cannot be vaccinated or who are at higher risk of complications. Hand hygiene is another fundamental habit Dr. Altman highlights. Influenza viruses can survive on surfaces such as door handles, mobile phones, tables, and railings for hours. When people touch these surfaces and then touch their face, especially their nose, mouth, or eyes, the virus can enter the body. Regular hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent infection. When soap and water are not available, alcohol-based hand sanitizers can be used as a practical alternative. Dr. Altman advises making hand hygiene a routine, part of daily life, especially after being in public spaces. Avoiding close contact with sick individuals is another essential preventive measure. Dr. Altman explains that many people underestimate how easily influenza spreads through close interactions. Even brief conversations at close distance can be enough for transmission. Maintaining a reasonable physical distance from people who are coughing, sneezing, or showing flu-like symptoms can greatly reduce risk. If you are the one who is sick, it is equally important to protect others by limiting contact, staying home, and wearing a mask when necessary. This sense of responsibility helps break the chain of transmission. Respiratory etiquette is closely linked to this advice. Covering coughs and sneezes using a tissue or the inside of the elbow prevents droplets from spreading into the air or onto surfaces. Used tissues should be disposed of immediately, and hands should be cleaned afterward. Dr. Altman emphasizes teaching these habits to children early, as schools are common environments for flu transmission. Good habits learned in childhood often last a lifetime and contribute to healthier communities. Another important aspect Dr. Altman discusses is the role of indoor air quality. Influenza spreads more easily in poorly ventilated indoor spaces, where virus particles can linger in the air. Improving ventilation by opening windows, using fans, or ensuring proper airflow in buildings helps dilute and remove infectious particles. During colder months, people tend to keep windows closed, increasing the risk of transmission. Dr. Altman encourages balancing comfort with safety by allowing fresh air to circulate whenever possible. Supporting the immune system through a healthy lifestyle is also a key theme in Dr. Altman's guidance. A well-functioning immune system helps the body fight infections more effectively. This includes getting enough sleep, as lack of sleep weakens immune defenses and makes people more susceptible to illness. Proper nutrition, including fruits, vegetables, proteins, and whole grains, provides essential vitamins and minerals that support immune function. Staying hydrated helps keep the respiratory tract moist, making it harder for viruses to take hold. Regular physical activity, even moderate exercise like walking, can also strengthen immunity and improve overall health. Dr. Altman also addresses the importance of recognizing flu symptoms early and responding appropriately. Common symptoms include fever, chills, cough, sore throat, runny or stuffy nose, body aches, headaches, fatigue, and sometimes vomiting or diarrhea, especially in children. When these symptoms appear, rest is crucial. Pushing through illness can prolong recovery and increase the risk of complications. Dr. Altman advises staying home, resting, drinking plenty of fluids, and seeking medical advice when symptoms are severe or do not improve. Antiviral medications can play an important role in treatment when used correctly. Dr. Altman explains that antivirals are most effective when started early, ideally within the first 48 hours of symptom onset. These medications can shorten the duration of illness, reduce symptom severity, and lower the risk of complications, especially in high-risk individuals. However, antivirals are not a substitute for vaccination and should be used under medical guidance. Special attention is needed for vulnerable populations. Dr. Altman stresses that older adults, young children, pregnant women, and individuals with chronic conditions such as asthma, diabetes, or heart disease should be extra cautious. For these groups, influenza can lead to serious complications like pneumonia, worsening of existing health problems, or hospitalization. Caregivers and family members of vulnerable individuals should also follow preventive measures strictly to avoid bringing the virus into the home. Mental awareness and calmness are also part of Dr. Altman's overall health message. Fear and misinformation can cause panic, leading people to make poor decisions. She encourages relying on trusted medical advice rather than rumors or unverified sources. Understanding that influenza is common, manageable, and largely preventable helps people take sensible precautions without unnecessary anxiety. In daily life, Dr. Altman's influenza health tips translate into simple, consistent actions: getting vaccinated every year, washing hands frequently, being mindful of close contact, improving indoor ventilation, maintaining a healthy lifestyle, and staying home when sick. None of these measures alone is perfect, but together they form a strong protective shield. Influenza is not just a personal illness. It is a public health issue that requires collective responsibility. Ultimately, Dr. Monica Altman's guidance on influenza reflects a balanced approach that combines medical science with practical daily habits. Her advice reminds people that health is protected not only in hospitals and clinics, but also in everyday choices, made at home, at work, and in public spaces. By practicing awareness, hygiene, prevention, and compassion for others, individuals can protect themselves and contribute to a healthier society. Especially during flu season,